In this presentation, we will talk about Medicare Advantage Plans, Part C. We will cover the following: what's an MA plan, how MA plans work, MA plans cost, who can join, when to join and switch plans, and other Medicare health plans. Just want to make a note that in this presentation, when we use the term Medicare Advantage Plans, MA, we mean those with and without prescription drug coverage. Medicare Advantage MA plans are health plans options approved by Medicare and run by private companies. They are part of the Medicare program and are sometimes called Part C. MA plans are offered in many areas of the country by private companies that sign a contract with Medicare. Medicare pays these private plans for their members' expected health care. Medicare Advantage plans provide Medicare-covered benefits to members through the plan and may offer extra benefit that original Medicare doesn't cover, like vision or dental services or allowances. The plan may have special rules that its members need to follow. In Medicare Advantage plans, you get all Medicare-covered Part A, hospital insurance, and Part B, medical insurance services through that plan. Some Medicare Advantage plans provide additional benefits. Many plans also include Medicare prescription drug coverage. This is Medicare Part D coverage. In some plans, like Medicare Health Maintenance Organizations, HMOs, you may only be able to see certain doctors or go to certain hospitals. You save the most money out of pocket when you get services through the plan's network. Benefits and cost sharing in a Medicare Advantage plan may differ from original Medicare. It is important to note that when you join a Medicare Advantage plan or other Medicare health plan, you are still in the Medicare program. Medicare pays these private health plans for your care every month, whether you use services or not. You still have Medicare rights and protections. You'll have the opportunity to join another Medicare Advantage plan or return to original Medicare if the plan decides to stop participating in Medicare. If you join a Medicare Advantage plan, you must continue to pay the monthly Medicare Part B premium. The Part B premium in 2017 is $109 for most people or $134 for those not held harmless. A few plans may pay all or part of Part B premiums for you. Some people may be eligible for state assistance, programs for people with Medicare who have limited income and resources, which is Medi-Cal in California. When you join a Medicare Advantage plan, there are costs you may have to pay, such as an additional monthly premium to the plan, deductibles, coinsurance, and copayments. These costs may be different from original Medicare, may vary from plan to plan, be higher if you go out of network. Medicare Advantage plans are available to most people with Medicare. To be eligible to join a Medicare Advantage plan, you must be enrolled in Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. You must also live in the plan's geographic service area. You must be a United States citizen or lawfully present in the United States, and you cannot be incarcerated. To join a Medicare Advantage plan, you must also agree to provide the necessary information to the plan, such as your Medicare number, address, date of birth, and other important information. You must follow the plan's rules and belong only to the Medicare Advantage plan at a time. You can join a Medicare Advantage plan when you first become eligible for Medicare during your initial enrollment period, which is technically called the initial coverage enrollment period, which begins 3 months immediately before your first entitlement to both Medicare Part A, hospital insurance, and Part B, medical insurance. It's important to know that if you delay Medicare Part B enrollment, for example, due to active employer group coverage, your time to enroll in a Medicare Advantage plan may be more restricted. Your initial enrollment period begins 3 months before your eligibility to both Medicare Part A and Part B. It ends on the day before your eligibility to Part A and Part B begins, or the last day of your Part B initial enrollment period, whichever is later. You can only join one Medicare Advantage plan at a time, and enrollment in a plan is generally for a calendar year. You can also join or switch to another Medicare Advantage plan during fall open enrollment. This period runs from October 15 through December 7 each year, and anyone with Medicare can join, switch, or drop a Medicare Advantage plan. Your coverage will begin on January 1st as long as the plan gets your request by December 7th. If you get Medicare due to a disability, you can join during the 7-month period that begins 3 months before your 25th month of disability and ends 3 months after your 25th month of disability. Plans must be allowing new members to join. Plans may be prohibited from accepting new members if there is a Centers for Medicare and Medicaid Services approved capacity limit, or the CMS issued enrollment sanction is in effect. You may be able to join or switch plans if any of these special circumstances that grant a special enrollment period apply to you. If you move out of your plan service area, if you have Medicaid, are enrolled in a plan that decides to leave the Medicare program or reduce its service area at the end of the year, leave or are losing employer or union coverage, enter, leave at, or are leaving a long-term care facility, qualify for extra help, you have a continuous special enrollment period, meaning you can enroll in or switch your plan at any time. If you lose your extra help status, if you join or switch to a plan that has a 5-star rating, receive notice of retroactive Medicare entitlement, or in other exceptional circumstances. Please note that in the cases of retroactive entitlement, there are special rules that allow for enrollment in a Medicare Advantage plan, or original Medicare and a Medigap policy. Medicare uses information from member satisfaction surveys, plans, and healthcare providers to give overall star ratings to plans. Plans get rated from 1 to 5 stars. A 5-star rating is considered excellent. You can use the 5-star special enrollment period to enroll in a 5-star Medicare Advantage only plan, a 5-star Medicare Advantage plan with prescription drug coverage MAPD, a 5-star Medicare prescription drug plan PDP, or a 5-star Medicare cost plan as long as you meet the plan's enrollment requirements. For example, living within the service area. If you're currently enrolled in a plan with a 5-star overall rating, you may use this special enrollment period to switch to a different plan with a 5-star overall rating. The Centers for Medicare and Medicaid Services, CMS, also created a coordinated and special enrollment period for prescription drug plans. This special enrollment period lets people who enroll in certain types of 5-star plans without drug coverage choose a prescription drug plan if that combination is allowed under the CMS rules. You may use the 5-star special enrollment period to change plans one time each year between December 8 through November 30. Once you enroll in a 5-star plan, your special enrollment period ends for that year, and you're allowed to make changes only during other appropriate enrollment periods. Your enrollment will start the first day of the month following the month in which the plan gets your enrollment request. Plans get their star ratings in October, effective January 1st. You may lose prescription drug coverage if you use this special enrollment period to move from a plan that has a drug coverage to a plan that doesn't. You'll have to wait until the next applicable enrollment period to get coverage and may have to pay a penalty. If you belong to a Medicare Advantage plan or Medicare Advantage with prescription drug MAPD plan, you can switch to original Medicare from January 1st through February 14. If you go back to original Medicare during this time, plan coverage will take effect on the first day of the calendar month following the date on which the election or change was made. To disenroll from a Medicare Advantage plan and return to original Medicare during this period, you can make a request directly to the Medicare Advantage organization or by calling 1-800-MEDICARE. If you make this change, you may also join the Medicare Prescription Drug Plan, PDP, to add drug coverage. Coverage begins the first of the month after the plan receives the enrollment form. If you have a Medicare Advantage plan, you may or you may not be able to buy a Medicare Supplement Insurance Medigap policy. It will depend on your individual circumstances. Certain federal rights may apply. States may provide additional protections. You can buy a Medigap policy anytime a plan will sell you one. You may not join another Medicare Advantage plan during this period. It's important to remember that anytime you enroll in a new Medicare Advantage plan, MAPD or PDP, it will automatically disenroll you from your previous plan. This includes Medicare Advantage only, HMO, or PPO plans. However, there are limited exceptions for members of Medicare only private fee-for-service cost and Medicare medical savings account plans. Once enrolled, coverage begins the first of the month after the plan gets the enrollment form. Medicare Advantage plans include Health Maintenance Organization, HMO, HMO Point of Service, Preferred Provider Organization, PPO, Special Needs Plan, Private Fee-for-Service, or Medicare Medical Savings Account. Some types of Medicare health plan that provides healthcare coverage aren't Medicare Advantage plans, but are still part of Medicare. Some of these plans provide Part A, hospital insurance, and/or Part B, medical insurance coverage, and some also provide Medicare prescription drug coverage Part D. These plans have some of the same rules as Medicare Advantage plans. Some of these rules are explained briefly on the next view in the next following this presentation. However, each type of plan has special rules and exceptions, so you should contact any plans you are interested in to get more details. Examples include Medicare cost plans, innovation projects, and pilot programs, and Medicare program for all-inclusive care for the elderly, or PACE plans. One of the options to compare plans and enroll in plans is by visiting Medicare.gov.